Hey, it's Dr. Hampton here. Welcome back to the channel that helps you get to the root cause of your health problems so you can thrive, not just survive. Today we're diving into a condition that far too many people suffer from, neuropathy. You might know it as that burning, tingling, or numb feeling in your feet or hands. And if you've ever felt like you were walking on pins and needles, or like your socks were full of hot sand, you are not alone. This video will be packed with real solutions. I'll share the top 10 ways to reverse or relieve neuropathy naturally, explain the science behind what's going wrong, and I'll even tell a true story of a patient who turned their nerve pain around. Before we get into that, do me a favor. Comment below and let me know where you're watching from. And if you or someone you love has dealt with nerve pain, I'd love to hear your story. So here's what sparked this video. I was talking to my wife, Karan, and she works in a pharmacy. She told me, Tony, I'm filling prescriptions all day long for medications used to treat nerve pain. It seems a lot of people are dealing with this problem. Now let's be clear, these meds can reduce the symptoms of neuropathy. Things like gabapentin, pregabalin, duloxetine. But here's the problem, you don't fix the root cause. They're like a fan blowing smoke out of the window while the fire is still burning in the basement. The future I see is the day when Karan is handing out alpha lipoic acid, omega-3s, and magnesium instead. Because people finally understand that healing the body is better than just numbing the pain. Let's start with the basics. What is neuropathy? Neuropathy is simply nerve damage. The most common kind is peripheral neuropathy, which affects the nerves in your legs, feet, arms, and hands. It can feel like numbness, tingling or pins and needles, burning, stabbing pain, even sensitivity to touch like bed sheets feeling like sandpaper. The most common cause, diabetes. But there are others we'll talk about shortly. Now here's the most important thing I'll say today. The number one treatment for diabetic neuropathy isn't gabapentin. It's getting your blood sugar back to normal. Let's talk numbers. The American Diabetes Association recommends an A1C of 7%. But here's the truth. An A1C of 7 equals an average blood sugar of 154 milligrams per deciliter. That's still high. Normal blood sugar means fasting glucose between 70 to 100. A1C around 5.4% or less. So I always ask my patients, why would you settle for abnormal and expect a normal outcome? If you keep your blood sugar elevated even moderately, you're slowly damaging your nerves. The glucose creates advanced glycation end products, those tiny landmines in your bloodstream that bind to nerves, mess with mitochondria, and trigger inflammation. But here's the twist. Sometimes when you finally start to normalize your blood sugar, the pain actually gets worse temporarily. You may ask why? Because your nerves are waking back up. Think of it like a leg that's been asleep. When the blood rushes back, it tingles and hurts before it feels better. That's healing in motion. Let's expand the lens. Diabetes isn't the only cause of neuropathy. Here are some others you may not know. Vitamin B12 deficiency, especially in people on metformin or acid blockers. B1 deficiency from high-carb diets or alcoholism. B6 excess. Yes, too much can be toxic. Vitamin D deficiency. Autoimmune diseases like lupus, Sjogren's, or rheumatoid arthritis. Infections, Lyme disease, shingles, HIV. Toxins, heavy metals like lead or arsenic. Alcohol, this is a big one. It's a neurotoxin and depletes B vitamins. Chemotherapy, idiopathic, which often just means undiagnosed metabolic inflammation. So if you're feeling these symptoms and don't have diabetes, it's still worth digging deeper. Now let's walk through the top 10 things you can do today to treat neuropathy from the inside out. These are real, research-backed root cause strategies, not just cover-ups. Number 1, normalize blood sugar. Whether you're pre-diabetic or diabetic, the first step is to stop the sugar roller coaster. Low-carb, ketogenic, or carnivore diets are an excellent tool. And remember, the closer your A1C is to normal, the lower your risk of nerve damage. Number 2, check your nutrient levels, especially B12, B1, benfotiamine is the best form, vitamin D, magnesium, and B6 because too much causes harm. You'd be shocked how many people walking around with neuropathy are just deficient. Number 3, add targeted supplements. Here are my top choices. Alpha lipoic acid, 600 to 1800 milligrams a day. It's an antioxidant and supports nerve healing. Benfotiamine, 300 to 600 milligrams per day. Fat-soluble B1 reduces nerve inflammation. Acetyl-L-carnitine, 1,000 to 2,000 milligrams per day, helps regenerate nerves. Magnesium glycinate or malate relaxes muscles, supports nerve conduction. Methyl B12, 1,000 to 5,000 micrograms, especially if low. Omega-3s like DHA, EPA, they reduce inflammation and support myelin repair. Number 4, exercise regularly. Walking, resistance training, anything that increases blood flow. And remember, nerves need circulation to heal. Even 10 minutes of movement a day can help. Number 5, cold plus warm water therapy. Alternating warm and cold foot baths stimulates nerve endings and improves blood flow. Great for symptom relief. Number 6, infrared or red light therapy. This may sound like sci-fi, but red light boosts mitochondrial energy or ATP and can help nerves repair faster. Number 7, avoid alcohol and smoking. Both damage nerves directly and indirectly. Alcohol depletes B vitamins and nicotine restricts blood flow. Number 8, prioritize sleep. Your nerves heal while you sleep. Aim for a deep, uninterrupted rest. Magnesium and stress reduction can help. Number 9, explore acupuncture or TENS therapy. Some people find great relief using electrical stimulation or acupuncture to rewire nerve pathways. Number 10, eat anti-inflammatory real food. Cut the seed oils, sugar, and ultra-processed carbs. This is where carnivore and ketogenic diets shine. So let's bring it home. Neuropathy isn't just about pain. It's about nerve health. Medications may help symptoms, but root cause healing comes from lifestyle. Supplements and food can be just as powerful when used with purpose. Let me share a quick story. I had a patient, we'll call him James. He came to me with numb feet, constant burning, and was ready to start gabapentin. We ran labs. His A1C was 8.2. He was low in B12 and vitamin D. I put him on a strict low-carb diet, added alpha-lipoic acid, benfotiamine, and methylated B-complex. 4 months later, he walked into my office and said, "Doc, I feel the floor again." Was it overnight? No. Was it worth it? Absolutely. Root cause medicine always is. Today, my wife is handing out gabapentin scripts. But imagine a future where people walk up to the counter and say, "Hey, Karan, where's your benfotiamine?" Or, "Do you have magnesium glycinate in stock?" That's a future where people are no longer settling for just feeling better. They're aiming to actually get better. So if you're dealing with nerve pain, don't lose hope. You don't need to live with it forever. Start by changing what you eat, fixing your blood sugar, and supporting your nerves with what they need to heal. So if you've made it to this point in the video, like and subscribe if this video helped you. Drop a comment with your story or question. And if you are ready to learn more, click on the video on the screen or subscribe to my channel. Let's stop managing symptoms and start building health. I'm Dr. Tony Hampton, and I'll see you in the next video.